All right. I think that pause got us to a critical mass. We're nearing 1,000 attendees, so I think we're almost there. So we're going to go ahead and kick things off. So I'm going to start with a few logistics, and then we'll start talking with each other. So we'll start off with our disclaimer that the views, opinions, and content expressed in this presentation don't necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. My name is Kristen Lupfer. I'm the project director of the SAMHSA SOAR TA Center, and I have been absolutely honored to work with you in this role and work with you on SOAR for the last 16 years. And we look forward to talking with you about how you can continue the incredible SOAR work that you're doing without the TA Center. A few logistical things. We are in listen-only mode, so all lines are muted. We've got a big group with us today, but we do want to hear from you. So we'd like for you to ask your questions in the Q&A feature. There's a Q&A function at the bottom of your Zoom screen, and we will gather your questions there and we'll sort through them, and I'll tell you how we're going to do that in just a minute. The chat is disabled. We're going to reserve that for resource links and other information that we're going to provide to you during the call. So chat will be for kind of that sharing of information from us to you, and we'll gather your questions in the Q&A. We are so pleased to offer accessibility features today. We're joined by Kip and Dave, our ASL, American Sign Language interpreters. We have live captioning available, and Rhonda is providing that captioning for you. So if you'd like to turn on live captioning, you can click on the CC Show Captions in your Zoom application. And we also have Spanish interpretation available. So if you would like to listen live in Spanish, Enrique and Suzanne are providing that interpretation for you. And you can choose that language, the audio language in your Zoom application. All right, so we are gathered here today because most of you have seen the news, obviously, and why you registered and joined us today to learn about the TA Center closing and how to SOAR work without the TA Center. Our first message to you, and the thing that we want you all to remember when you leave this webinar today, is yes, you can do SOAR applications. The SOAR model is not ending. SOAR assistance for SSI and SSDI applications is not ending, it's continuing. And we're going to talk about how to do that. It's continuing because we are here today and you are here today because of the people we serve. Those people who are experiencing or at risk of homelessness, who have disabilities, who need assistance in accessing their life-saving, transformational benefits. We get so much joy out of hearing success stories of how people have been approved for benefits, how this transforms their lives. And, you know, it's been, as you all can imagine, you know, a tough few weeks as we prepare for this closure. And I got an email this week from a SOAR practitioner, and she said, on a brighter note, I just had the fortune of telling a new PATH participant that he's approved for SSI with 2 years of back pay. He cried lots of happy tears, and he made my whole day. And in turn, made my whole day. And I think really is just one example of the thousands and thousands of examples of impact that you all make as you use this model to help people access benefits quickly. So a little bit about the SOAR TA Center and what it means about the SOAR TA Center not being available. The role of the SOAR TA Center has been, for the last 16 years, and us at Policy Research Associates in years prior to that, with the developing of the SOAR model and the original Stepping Stones to Recovery curriculum that transformed into the SOAR online course. All of that work went into creating a model of submitting complete quality applications. It created a model of supporting people through the disability application process by building rapport with good engagement skills by being clinical Columbos and getting out there and finding information to help document disability, making sure that we're providing all of the evidence we can to show the Social Security Administration and the Disability Determination Services that in fact this person is eligible for benefits, and this is why, and this is how we're helping support someone both through that documentation and follow up on their claim. All of that is the model. We talk sometimes about how a SOAR application is expedited intrinsically. It's not that it's getting pushed through the system faster because there's this magic SOAR word on it. It's making its way through the system faster because we have completed a quality application. We're following up with our contacts at SSA and DDS, and we're making sure that they have the evidence they need to make a decision quickly, right? So SOAR will continue because that model of quality complete applications can be done without the TA Center, without the support of the online course. It can be done with the work that you all do in supporting applications. So we just want to make sure that you know how important that piece of it is, and that you can do this. And we're going to talk about ways you can. All right, so what is going to become very important is our state and local teams. You all have wonderful networks of state and local leaders who are implementing SOAR in your communities. And now is the time to lean on them, to lean in together and support each other. So we'll talk about that communication and networking and how important those state and local networks will be to you as we move forward. We'll talk about SOAR training. So real quickly on the kind of status of SOAR training. There's a lot of information about this in the SOAR TA Center closing FAQ. Abby's put that link in the chat box. You can go there and review that if you haven't seen it yet. But basically, the SOAR Works website that includes the course and the library and tools, and the SOAR OAT website, which is for tracking outcomes, SOAR outcomes, will be discontinued and decommissioned after August 18th, on or after August 18th. So SAMHSA will be shutting those websites down. So they won't be available to the SOAR community. So our message about the information and resources on the websites, please download any resources, any worksheets, any information or materials that are on the website, in the library that you want to keep, download it, archive it, save it. Same thing goes with OAT and all of your outcomes. Please log into OAT, track those outcomes for this fiscal year. We'll talk about this more. We're already seeing incredible outcomes coming in. It's looking like there's going to be over 4,000 decisions this last fiscal year with just an incredible approval rate. I think it's going to be over 66% approval rate, higher than our cumulative national average. Really fantastic SOAR work has been going on this past year, and we want to help you celebrate that. So get those outcomes in and then download your reports so that you can keep celebrating that great work. So that's what's going to happen after August 18th. The websites will be decommissioned, and the SOAR TA Center team won't be available to you any longer to answer your questions. So that was our role before. We hosted the website, we provided that individual TA, provided these kind of virtual webinars and learning opportunities and all that great information for all of you. So that's the piece that won't be available now, or I should say in a couple of weeks. But what will be available to you is the SOAR model, your state networks, the collaborations that you've built, and kind of other avenues and new avenues for connection, resources, and support. What we want you to do is turn to the resources you have. So if you have questions and you're not sure about what's next in the process, the standard SOAR process will be an excellent reference and guide to turn back to and say, what am I supposed to do next in support? The standard SOAR process, if you're not already using it regularly or you're newer to SOAR implementation, that will be an excellent guide for you to make sure that you're finding the tools, the forms, the information, resources you need to follow the model. And then there's, you know, a lot of other resources available in the tools and worksheets section of the website. We've created some zip files so you can more easily download kind of the packet of worksheets that you'll need to assist with applications. So be sure to take those steps. And then finally, maybe my kind of last word before we kind of transition into questions in that process is that we hope that you will keep fidelity to the model. SOAR works because we implement the SOAR critical components. SOAR works because we submit complete quality applications. Those complete applications include medical records. It includes a medical summary report. So now is not the time to slim down the model, to slim down what you're doing. Now is the time to keep doing those complete quality applications and make sure that as you're assisting folks that you're really doing and developing the best application that you can so folks can get approved that first time and get approved quickly. All right, so the way that we're going to kind of take in and talk about kind of the questions that you all have for you. So this will be, if any of you have been to a soaring over lunch, we're gonna model this a little bit like soaring over lunch. And so Abby is gonna be our question mover moderator for this and ask questions of the team that we're gonna try to answer for you. And we're gonna answer them in these different buckets. So we wanna hear your questions about SOAR training and what you can be doing now, what you might be able to be doing in the future, how you can track outcomes, what states are doing, what some folks are thinking about with outcome tracking. In states where there's already kind of a structure and a system, some state leaders and local leaders have come up with ways to keep track of outcomes, either through kind of Google Sheets or special like tracking programs online, HMIS, Excel spreadsheets, lots of different ways that folks are tracking outcomes, but really emphasizing the importance of continuing to keep track of the great work that you're doing to show that this model is effective, that this work does work, and that we need to keep supporting it. SSA and DDS collaborations are continuing, and there is enthusiasm from our partners to continue to work locally and at state levels to keep those collaborations going. So just to like head off those questions right away, SSA and DDS are in support of continuing to participate in their local collaboration efforts and continue the work that they're doing with SOAR teams. So a lot of great enthusiasm and support still with our SSA and DDS partners. And then finally, for communication and networking, on the SOAR website, in the state directory, you've got the names of your state team leads, you've got the names of your local leads. We want you to keep in contact with each other. Your state and local leaders will have information about the folks who've passed the course. Many of them already have active SOAR caseworker lists that they'll be able to keep in contact with each other in that way. So that's one more piece that we think is really important. All right, so I think we're ready for some questions. So Abby, did you want to say anything as we like kick off the questions?
No, I think that we've got a lot of really great questions coming in. A lot of people are asking similar questions. So I am going to summarize many of the questions that folks are asking and we can go from there. So Kristen, I'll throw the first couple to you. And this is just about some clarification, again, around training. So if someone has not completed the SOAR online course, are they still able to complete SOAR applications? And how would you suggest they go about finding how to become SOAR trained?
Yeah, great question. So I would say I'll start with the states that might have a certification process. So if you're a person who wants to be SOAR trained, you want to assist with applications, using the SOAR model, but you didn't get a chance to complete the SOAR online course before that the practice case was turned off for new submissions. So what you can do, first step, contact your state team lead if you have one, and ask whether or not they have a training plan or a state certification process. So we have a number of states that have put something in place to try to help train and certify SOAR caseworkers. So you want to check that first. That's a really important piece, because in states where that exists, in order to be added to like an active SOAR caseworker list that might be shared with SSA or DDS, you need to go through that process. You want to check with your state lead there. Otherwise, so if you don't have a state process, there's not, a path you can take in that way. I would say from now until August 18th, I would spend some time in the SOAR online course, review all of the materials there. You won't be able to submit a practice case for review and receive an official certificate of completion, but you can learn all of the information. That information is there for you to read and to learn, to download the worksheets and resources and information. We really want you to work at, figuring out where you can go for information in the future. So this is another piece that I think is really important, is to think about, okay, I know where to go on SSA's website to get updated SSA forms. I know where to go on SSA's website to submit the online application. I've got my SOAR worksheets downloaded here. I can sign up for SSA updates at this listserv here, which will provide those links to you. I think a really important piece about staying up to date on any changes that might be coming in. You can bookmark all of the key links. You can bookmark the link to the SSA listings of impairments. So you've got that ready to go. So you can equip yourself with the information that you need to submit good quality claims. And then I would encourage you to connect with those SOAR leaders in your state. Every state has a SOAR leader in the state directory, even if there's not a state lead, to find someone who can kind of be your mentor and can help you out. There are SOAR online course review sessions that are recorded and posted on YouTube. So we can give those links in the chat as well. Save that review session, save that link, watch that, review it, answers a lot of questions, reviews the process of submitting applications, developing applications, and can be a really great resource to you. So for those folks who are just learning the process now, each of these pieces will help to support you in that. And I would invite any other team members with advice about kind of getting trained without that kind of final certificate.
All right, so the next one I'm going to give to Amanda, because I know you have some states that have SOAR certifications. And as a reminder, many states have gone above and beyond the SOAR online course, and they have certification processes. So Sean asks, what does the SOAR online course going away and the SOAR TA Center ending mean for statewide states that have certification processes? And what would you recommend to people who need to maintain those certifications every year?
Yeah, so if your state has a certification process and certification criteria to maintain certification, then it's very likely that your state team lead is developing a plan for the continuity in continuing the certification process. So your state team lead will now be your primary point of contact for SOAR and all things related to certifications. Each state will be developing their own certification process if they have a state lead. So that's what you should look towards. If you are in a state that does not have a certification process, there will not be a recertification training because the SOAR online course won't be available anymore, and the TA Center also will not be available going forward.
Thanks. All right, Kristen, I'm going to send this one back to you. And so this has to do with videos. A lot of people have asked what's going to happen to the webinars that are posted on YouTube, the videos in the course, and can you share the difference between the SAMHSA YouTube link where it is and the Policy Research Associates link where some of these are also posted?
Yes, Absolutely. So what I can tell you is that the Policy Research Associates SOAR playlist will remain. So we'll keep all of those recordings up on our playlist. So please, feel free to save that playlist to keep it. You'll be able to access those there. We aren't going to remove them. It's possible that the videos remain on SAMHSA's YouTube. We just can't guarantee how long that will be. So I would say, keep checking there. You can keep those, but if you need to get them live, you can get them on the PRA YouTube, or I think if you have YouTube Premium, there's download options where you might be able to download some of those videos.
Okay. All right. So let me throw this next one to Dazra. So Dazra, there were a number of folks who asked about how can we reach out to our state teams? Will they still be available for assistance? Who are our local leads and how do we find them? So what would be your best recommendation for people who want to reach out to the folks in their communities?
I would start with reaching out to your state team lead, and that information is still available on our website until the 18th. So, as much information that you can snag from the website with regard to the contacts, I would reach out first to them, and you can always contact me and other liaisons that are still available until the 15th of August to find out if there's specific contacts that you should know and be aware of. So using us until the very end is always an option, and the information that's still available to you on the website is where you can start.
Okay, so to follow up on that, and I'll give this to all of the liaisons, some folks are concerned that they might not have a SOAR state team lead, or they may not have a solid foundation for SOAR in their community. What can they do in that case, or what is a good recommendation? And Daz or Pam, anyone who wants to jump in on that.
I can start, Abby, if you like.
Yeah.
Yeah, so I would say if you live in a state with an absence of a state team lead, look around to see what existing resources are there. Are there local leads? Even if not in your county or your community, are there other local leads within your state? If there are not, look around in terms of who are the other folks around that are kind of doing SOAR work, right? That are trained in SOAR, have been doing SOAR work, because it might be an opportunity for peer-to-peer learning and sharing and support, even in the absence of a state team lead, even in the absence of a local lead. I would also mention that if for some reason you find that you do not have those kind of existing resources in your community, certainly reach out to your TA center liaison. They would be glad to kind of help you find other caseworkers, either in maybe similar states or maybe in the same region, that they would be glad to be able to possibly connect you to, so that you have some sense of community and some sense of support. The one thing you shouldn't do is despair that there is no support, because there absolutely is. It's just looking at what the existing resources are. Even if it isn't a state team lead, there is some existing resource that will be there to support you.
Absolutely. And to kind of add on to that comment, thanks, Sumitra, is to look at your neighboring states. If there's a state that's neighboring to you, they're likely in the same Social Security region, and you want to be able to connect with them. And if you don't have a state team lead, kind of think about, whether or not you have the capacity to do so and become that in which you wish to see in your community. Understanding the role of a state team lead and understanding whether or not you have the capacity to do that, or even share that experience with someone that's just as interested, can always be an option. But I really encourage you to just, if you don't have a state team lead and you're looking for additional support, look within your community, of course, but also look at those neighboring states, especially the ones that are doing quite well with SOAR.
All right. So Kristen, I'm going to send this one back to you. So this is about downloading things for reference. So I know that you spoke about things that should be downloaded. So a couple people are asking, one, can you download the whole course? And if not, what's the best way to do that? And then what are some things that you recommend folks download? If you could just reiterate that.
Yeah, great question. Right before I answer it, though, I did want to say, add on to Dazra's response about becoming the thing that you want. This is what we did before there was a TA center. I remember getting started with SOAR in the state of Georgia in 2007. There was no TA center. There was no connection between the SOAR states that existed at the time. It wasn't even nationwide yet. And I remember finding my neighbor states and saying, let's get together and talk about how in the world we're going to like start getting this program going, right? And so I think that that's something now that you can build off what we've been growing, you know, for the last 16 years, and do that in, you know, in different ways, in maybe smaller ways, but really lean on each other. So thanks for that, Desiree. All right, so what to download? Let's go back to this. So we're talking about, we're going on the website, we're focusing in on the resources that we want to keep. What should we focus on? Okay, I would start in the SOAR tools and worksheets page. And there are some zip files that we've put at the top of the page that Susie has put up there for you. And it will have the tools and worksheets you need for assisting with applications. So that's really focused on the application assistance piece. And then I would go into the library and I would download those resources and references that are key to the population you serve. So if you work with older adults, make sure you save that FAQ. If you're working with veterans, there's a dozen resources for veterans, save all of those. If you're working with children and youth, make sure you're grabbing the youth and young adults FAQ. Make sure that you're grabbing the child version of tools and worksheets. Go through the library and download those FAQ documents. If you are kind of supervising SOAR workers or you're helping to lead SOAR in your community, focus in on those systems level documents. Go to OAT and outcomes tracking, download the data form, download the spreadsheets, get what you need so that you can keep your work going on the systems level. In terms of the course, we don't have any easily downloadable way to download the course content in its entirety. You can print each article in the course, save it as a PDF. That's a lot. You don't need to do that, and it's going to go out of date. But what you can do is think about, what is the article that I reference a lot? What are those key parts of the course that I keep coming back to, or that I need to come back to, or that I want to be able to review? Maybe it's in the child curriculum when you're thinking about the functional domains and you want examples of functional impairments in the different functional domains for a particular age group. You're like, oh, I just want that reference. Download in PDF that article there. So think about, you know, those pieces that you want to reference back or that you reference back. I think in both the adult and child curriculum, the articles on functional documentation and examples are really important and really key there. I'm about to go through and tell you to download everything. But the gosh, I think the resources we have on SSA's online services, the resources we have on post-entitlement scenarios that come up are so helpful and can be just also another great reference to have. Okay,
thank you. So I want to shift a minute to talking about SSA and DDS. So Sumitra, I'm going to send this one over to you first. So I know Kristen spoke about this a little bit before, but can you just provide a brief overview of how Social Security is still going to accept SOAR applications? A couple questions we got were, has Social Security and DDS been instructed to stop using the SOAR flag, which we know is not accurate? Some people said, will SSA still accept them? So can we talk about how SOAR is a complete application and Social Security and DDS will absolutely still accept those?
Yes, absolutely. So I know Kristen talked a little bit about this earlier, but you know, the important thing for SOAR providers to know is that we have heard from many of our national and regional SSA and DDS partners that they are absolutely still going to be supportive of those on the ground doing the SOAR work and maintaining, you know, whatever contexts are already in place in your state and or local communities. However, aside from that, I often like to remind, you know, SOAR caseworkers that SOAR in and of itself is a model, right? it's the best practice that we use when we are helping people to put together a disability application. So, when people often ask, like, are they still going to accept SOAR claims? Remember that SOAR isn't a separate set of forms or a separate application, right? It's the same traditional forms. It's just that you are simply turning in a complete application. You are turning in forms, you're turning in medical records, right? You're turning in all this supportive evidence. So even with the absence of the TA Center and even with the absence of the, the SOAR online course and being able to train new folks, at the end of the day, SOAR will always be alive because it is a model and a best practice that you can utilize to help people experiencing homelessness, to streamline that disability application process. And so, it isn't really a matter of whether, they're going to accept it or not accept it. It's simply a matter of that's the model you use to put together the application you formed, and you are turning it into SSA, and DDS, whose job it is to simply process the information that you are providing them in your packet.
Absolutely. Thank you. So Pam, I'm going to throw this one to you next. And I know we kind of talked about SSA, but what about DDS? Someone asked, will the DDS homeless specialists still accept SOAR applications and be around? And perhaps we can talk about a little bit about those states that have specific DDS SOAR adjudicators too.
Yeah, so in some of the states that I provide TA to, which also have a dedicated unit that decides SOAR assisted claims, they are going to recognize SOAR when those cases come through. They're going to still use the same kind of mechanism or process to get the case sent from the local SSA field office over to that unit. And even if a state doesn't have a dedicated DDS unit, we are hearing from many of our states that they're going to recognize SOAR claims. And I think if you're unsure, this is when you do want to reach out to your state lead or local lead or even DDS themselves. We can connect you to your professional relations officer or medical relations officer. They're called pros or MROs. These are the folks that are there to work with the community. So if you don't already have a process in place, reach out to them and start one. Utilize some of the tools that we have on how to build relationships with SSA and DDS. We have a wonderful kind of a conversation guide for that. So that'll be really great. Even if you're not an official local lead, you can become one and use your advocacy and get things started. So that's just my advice to empower you to be able to either create those relationships from scratch, but just knowing a little bit about what some other states are doing, that should give you some hope that SOAR is going to be around and recognized as a model for assisting folks who are homeless or at risk.
Thanks, Pam. Okay, Amanda, I want to get a little sticky, or I want to get into a specific topic, but we have a lot of questions in the chat about becoming a SSA appointed representative. And people, there is a little bit of confusion around whether or not this ID is given by the SOAR TA Center and how that's impacted. So can you just briefly talk about, once someone is trained, how they get their representative ID and how that is a Social Security thing and not a SOAR thing?
Yes. So when you complete the SOAR training and your work is reviewed by us at the Technical Assistance Center, we send you back a certificate of completion. That means you are SOAR trained from the National TA Center, and that's your SOAR certificate of completion. You file to become, or you apply to become an appointed representative with Social Security. The TA Center does not have anything to do with you getting a representative ID number. We have tools on our website that show you how to fill out that application and provide contact information for where to send that application, but we do not process that, and we have never given rep ID numbers. That is all Social Security's job. So going forward, you will still enroll to become an appointed representative and get that rep ID number with Social Security. You will not be able to serve as someone's representative unless you have a rep ID number. So it is required. You only have to do it one time. Once you have your rep ID number, it will stick with you. but you need to send that into Social Security and get a representative ID number, or you will not be able to serve as someone's appointed representative when you start assisting with applications.
Thank you. Okay, Kristen, I'm going to go back to you with this one. So some folks are asking, we're downloading all of these materials and whatnot, but how quickly are they going to become out of date? And I guess the bigger question to this is, what should SOAR trained practitioners be looking for in terms of changes to SGA and the federal benefit rate and form updates? And also, what is the best way to know about those updates?
Yeah, excellent question. So every year, there will be changes to the federal benefit rate, substantial gainful activity, and some other key federal thresholds, things like that. So when the cost of living adjustment is announced, SSA will make an announcement about that. There'll be a post, there'll be a message sent out on the listserv, or this is what has happened historically year to year. So we're going to drop a couple of links into the chat of listservs that you should sign up for from the Social Security Administration to get those messages. So you'll get information about the COLA changes, which will be relevant to, like we said, SGA, but also when you start looking at work incentives and threshold amounts for the trial work period, all of that information will be a part of that. So that's one thing that changes. Doesn't necessarily change process. Social Security generally will make announcements about regulation changes when something is specifically changed that goes on the Federal Register, or other changes that will eventually go into their program operations manual system, or the POMS, the SSA POMS. There'll be sometimes an emergency message, which is when they're kind of making a change, and it's kind of an announcement that something in that POMS, the way either that they process claims or process the eligibility, things like that, goes into the POMS and that emergency message system. There are sometimes, we kind of laugh about this sometimes, that Dan is the person on our team who always knows first that there's a new SSA form. Sometimes there's not an announcement when there's a new version. We just find that the new version gets posted on SSA's website. So there's, as most of you are probably aware, there is a place on the SSA website where you can search for all of the different forms that are publicly available and what they call self-service forms. There are some SSA forms that don't get put into that repository, and then sometimes you can find them posted online by searching for them, and they're on other websites, but it's a little, for the most part, the forms that you'll need and that are self-service and part of the application process, you'll be able to find in that repository. So it'll just be making sure that you, rather than like saving a copy of the SSA 1696 in your desktop folder and having it there, going back at least periodically, if not every time, to the ssa.gov link with the form, because that's where they'll update the latest version of it, and you'll see if the date changes, in the top corner of the form there. So yes, so here are the excuse me, newsletter and advocates listservs messages or links to sign up from SSA.
Thanks. Daz, I'm going to send this next one to you. So kind of a two-part question. So this is about outcomes tracking. Someone is saying, well, we still need to input our data into OAT. So let's first talk about how outcomes are due tomorrow. So you absolutely should put your outcomes in, but also your recommendations for tracking outcomes moving forward.
Yeah, so Abby hinted on the reminder. I'm going to just say the reminder. You should really make sure that you are, and even in the midst of all of this, outcome collection is still important. We're going to do our best to make sure that those are collected and gathered and communicated to you what the outcomes were, keeping in mind that the outcomes are really important for future funding opportunities, and also give a reminder for you to make sure you have access to all that pre-data from your state team leads about, you know, your outcomes cumulatively into this point, because the hope is that you'll continue with that cumulative information to move forward and keep building on the outcomes that you have for your state. So for tracking your outcomes with the absence of the OAT system, it's really important for states to really work together to design some way for you to be able to track your outcomes. Even if it's until you get, you know, I've had several meetings with my states who are thinking very, very strategically on how these outcome collections are going to look for their future. Some states are, you know, recommending that the paper version of the OAT questions that are available on the website be used in the interim between designing and formulating a true outcome collection system that's accessible to everyone in their state. So that is still available, that questionnaire that's available on the SOAR website with every single question that OAT asks can still be printed and still be used to track your outcomes. But getting together and working with your state to see what it looks like futuristically is really important. But in the meantime, tracking your outcomes independently is key. Whether you need to establish your own Excel spreadsheet with all the data that's requested in OAT, or however way you'd like to track it electronically or on paper, the goal is to continue to track your outcomes until a state plan has been established that determines how those outcomes are going to be collected as for the state as a whole. Does anyone else on the call have anything to add?
So I just want to follow up and get a little bit more granular, and perhaps this is a question for Kristen to kick off. So some folks are saying, my understanding is that there are many foundations or positions or government who require hard data on outcomes. And they also require SOAR training. Many contracts do, for instance, SSVF or PATH. How can we move forward with that? Or more so, who do we contact about this?
That's a good question. So there won't be a national SOAR training available from the SAMHSA SOAR TA Center. So that's the only definitive answer I can give right now. We don't know what the future will hold, whether, you know, national SOAR training will be available again in the future, you know, through a different funding mechanism or source. So what the answer is right now is that in some states, state leaders and local leaders are developing a localized version of training to help train people on the process, on the model, on the basics of SSI and SSDI eligibility, application processing, application development, and use of the SOAR model. So some of our state leaders have plans in the works to get that going, to get those curriculum available and ready to go. It won't be available in every state, and we don't have an answer for that, unfortunately. I will leave it there. What I would say about like outcomes and comparing outcomes and having like other outcomes to kind of benchmark yourself around, because I think that was part of kind of the outcomes question, is, you know, what Dasborough was sharing about communicating with each other, reaching out to your neighboring states. I think that could be one great way to do it, is that if state leaders stay in communication with each other, they can share the data that they have, share with each other, ask questions, solve problems together in this kind of peer networking way.
Okay, thanks.
And I guess one more thing about kind of the outcome comparison. You can look at, you know, prior years. So if you say, you know, these are our outcomes for FY 2025, you can compare that to what it was nationally in 2024. So it's not that far away in time distance, but could be, you know, a comparison to what, you know, the national average was while that was being tracked and reported.
So I'm going to start this question with Pam, and then let's move through the liaisons to kind of give your best advice. So someone asked, what can SOAR state team leads do to prepare? And I know that we at the SOAR TA Center as liaisons have been helping to prepare our state team leads and our local leads. But what would be your best advice for state team leads and local leads, and really folks on this call, to prepare for the closure of the TA Center and creating these state programs? So Pam, we'll start with you and then kind of go down the line.
Well, I think some of the more active state leads joined a call we had last week and kind of developed already a network of communication between state leads to share their best practices for doing things like downloading portions of the course to develop state trainings and all of the things that we talked about saving files and such. So I think they'll be meeting pretty regularly, and maybe before the TA Center closes, but certainly I think in maybe early September, just reconvening, if your state doesn't have things already, meetings, at least on a monthly basis, to start seeing, who needs TA support and how maybe some of the more seasoned case managers who are interested in doing some of that system level work would like to facilitate a training with all the materials that you've saved. So really just kind of figuring where you are at and, really tap into the folks that are in a leadership capacity and see where you can step up and say, hey, I want to be part of this growing SOAR, in my state and locality. So I think getting those meetings restarted, and maybe some states that have meetings on a quarterly basis, maybe you need to start doing them maybe on a bi-weekly, monthly basis, just as things get started again.
Amanda, did you want to add any advice to state or local leads?
Yeah, so Kristen mentioned the standard SOAR process earlier, and I think the best place to start is taking that standard SOAR process and making it fit with what the SOAR process in your state looks like so that you can get it down in writing. This will ensure that the people that will be trained in the future will have a set standard process to follow. This will help protect the integrity of SOAR assisted applications going forward. So I really, really encourage state leads or local leads to get together and sit down and flesh out that standard SOAR process to make it fit with the SOAR model in your state.
Daz or Sumitra?
I don't have anything to add.
I don't have any either.
Okay, Kristen, I'm gonna give this one to you. So some folks have been asking about what are some options for funding SOAR dedicated positions. And perhaps you can talk a little bit about our resources that we provide, and then also where folks can go to continue looking for those resources.
Yeah, that's a great question. So there's a number of kind of different funding avenues where we currently know that SOAR dedicated positions are funded through. So the SAMHSA PATH grant, which is a formula grant to states, there are a number of PATH positions, either full-time or part-time, that are funded through that mechanism. And SOAR assistance is still a priority for a lot of those programs. I know some of those state level programs are also using some of that funding to help kind of support the infrastructure for kind of SOAR support for their PATH teams and others. So that's definitely one mechanism. Some states have used either mental health block grant, community development block grant. There may be other block grants that will come down through HHS that may be available in states that are just kind of more flexible funding that support this population, and states can make decisions. So it's really about kind of making friends at your state's, Department of Behavioral Health and saying, hey, this is a priority for us. We really want to do this work. We really want to serve this population. These are the benefits. These are the outcomes. And, can we put into our, state plan or our block grant plan support for SOAR specialists or benefit specialists. a number of states are using Medicaid in that same way. And so I recommend on the SOAR website, again, Abby was referencing, we've got a bunch of resources there that you can go ahead and download and save with information about different ways that Medicaid can be leveraged to support SOAR positions, whether that's through specific billing codes for Medicaid funded agencies, or through Medicaid administrative claiming, which would require a conversation with your state Medicaid agency, but lots of just kind of relationship building and conversations about the importance of the work in kind of identifying these funding streams. I would say otherwise, you know, a service that we would use and way that we would help support states is through Candide and foundation funding searches. So that's a great way to do it. You can search for other kind of federal funding streams on grants.gov and some of those other sources that we've got listed on there. So lots of places to check out. I would say though, most of the SOAR positions are funded through state, county, or local funding, right? So it is our state governments, our county governments who are providing services to this population of folks that we are serving, and they want to provide those services better, and they want to have, you know, people accessing the stabilizing income and health insurance that they get through SSI and SSDI access and Medicaid and Medicare access. And so they fund those positions because they know it's going to help the individuals living in their communities and their states. And so I would also say, you know, looking to your state government and county government agencies that focus on serving individuals who are experiencing or at risk of homelessness, and talking with them about that, or looking to them for funding opportunities that might come up that would overlap and have SOAR as a kind of part of the mission of that funding stream.
All right, so we have about 2 questions left, so we got a little bit more time. So I would just say if you have questions that you would like us to address, feel free to put them in the Q&A. So Amanda, I know that we talked a little bit earlier about like how to get to know the updates that Social Security is putting out and changes. But I'm wondering if you could give us just a brief overview of the SSA POMs and the Blue Book and just places that people can go to find information about Social Security policy. And I'm also thinking specifically as it relates to people who work with specific populations and the nuances around that.
Okay, so the socialsecurity.gov website is a really good resource for all of so the POMS is the program operating manual system, and it provides how things, what facilitating the laws look like according to Social Security, and it also houses the adult listings. So if you have a question about someone's eligibility for benefits, you should be looking in the POMs, which you can put in the search bar in the SSA.gov website. Kristen just put a link to the POMs in the chat. So you can search for processing related questions there. If anything's related to someone's specific disability and how they can qualify for the disability criteria, you need to look at the Blue Book listings. The Blue Book listings provide information about Social Security's specific criteria for the specific types of conditions that the applicant might have. It will provide a list of all of the signs and symptoms that the applicant needs to experience, along with the level of functioning that is affected by the signs and symptoms that the applicant experiences in order to qualify for disability. So use those 2 resources. I wasn't exactly sure what you were asking for the second part of the question, though.
I think just looking through, if let's say you're working with someone who is a transition age youth or someone who's a non-citizen, like Social Security has all their policies and procedures around that on their website, and that can be a great resource.
Yeah, definitely. So if you have a question about someone aging out of foster care, or a name to put on the application. Social Security has all of that in their palms. So all of those rules can be found in the palms, and you can just search on their website for the information that you need.
Okay. So we've had a couple of questions, and I know we've talked about SSA and DDS a good bit. So Sumitra and Pam, I'm going to throw this one to you. So in the absence of the SOAR TA Center, who is the best person to talk to if I'm running into trouble with SSA and DDS, and who is going to work to maintain those contacts?
So I can kick it off. So definitely the first person I recommend you start with is either your state team lead and or your local leads. And I know we've been saying that a lot, but again, really training and kind of supportive responsibilities are transitioning to those state and local levels. And so your TA Center liaisons are working with your state team leads, with your local leads, to prepare them with the information they need. And that does include any, applicable or relevant SSA and or DDS contacts. Outside of that, you're always welcome, of course, to reach out to, the SSA public affairs specialists for your region, and those contacts are public. We can put the link in the chat box if you find yourself needing assistance beyond what your local field office can assist you with, or if you're not really able to kind of break through or connect with them. But again, I definitely recommend starting off with your state team lead and or local lead. Pam, I don't know if you want to add anything onto that.
I was going to say the SSA is Public Affairs Specialists, or PASSes as they're called, and they work under like the Regional Communications Office. So I think they're the folks that do work with the community and try to engage, with community partners and answer questions like that. Really try to connect you, to your local SSA office. So if you're having issues with your local SSA office, they can run interference for you. So again, the link, we'll share the link, and you want to become friends with those folks because, they are there to serve the public and to work with community partners, create new community partners, especially for the vulnerable population that SOAR does serve. So I encourage you to get to know your PASSes, and they'll be a great resource for you.
And I'd just like to add that kind of the structure that we really hope to develop by the TA Center is state team leads, local leads, and encouraging them to make use of their steering committees, right? And so if you have a steering committee available in your community, this would be a really great time. If you haven't engaged, or you started and you stopped going as much, this is absolutely the time to continue to engage with your local and state steering committees to help answer a lot of the questions that you're having, with regard to training and continuing developing relationship with SSA and DDS. This is the time, right? This is as a time such as this, right? To depend on everything that we've hoped that states would reproduce, and move forward with and develop the tools to move forward. Not in anticipation of the TA Center going away, but this is the time to use all of those things that you have put in place to get the answers that you need. Particularly with sustaining your relationship with SSA and DDS.
Great, thanks. So just about one or two more questions that we have. So I'm going to kind of pose this to Kristen, and then I'd love for the other liaisons to answer as well. So the question is in terms of kind of networking. So I know we've talked about trying to build our local SOAR network. So this person's asking, I'm going to reach out to my state team leads, but are there any networks that you can recommend of veteran SOAR caseworkers who could assist? And I know that we have given all of our contact information among state team leads and local leads. So we have those, but are there any other things any advice you can give for connecting with those fellow SOAR caseworkers, veterans or otherwise?
Yeah, so I don't have any, national level social groups to recommend. What I would say though, is it's a great opportunity to start them, like we've been saying. So I think starting with your state lead and saying, hey, let's start this group. Can you help me invite folks that are doing SOAR in our community, in our state? in our region, let's send out a message. Here's the link that folks can join. If there's a place where you feel like you can make those connections and want to do that. Some states are doing this. So I'm going to give a little shout out to the state of Kansas. They have a Basecamp group, and they use Basecamp as a way of communicating. So SOAR practitioners are added to the Basecamp group, can chat, share information, share files, ask questions, and they have that kind of social networking piece in a maybe non-traditional social networking platform. It's really like task organization and information sharing, but is a great spot and something that's really helpful to the SOAR community in Kansas. So I think going with your state and starting there and saying, let's get it going. Who wants to volunteer to set it up? Send out the invite link to folks to voluntarily join.
So we did have a follow-up. Well, I will say that they many people were saying Basecamp is awesome and that's a great use. So I want to follow back up on, I believe, what Sumitra said about social security communications and regional specialists. And are these the same as public affairs specialists? Just trying to get a clear line of like who to contact if we need assistance from the higher levels of social security.
Yeah, excellent question. So staffing and assignments to different public affairs positions at Social Security has been a bit in flux. There's been a lot of changes. It went from 10 regions. They've reduced the number of regions, reduced the number of staff working on that kind of regional level. So this is a little bit in flux and maybe continuing to kind of be fine-tuned over the next few months as things go. I would start with the regional communications directors and ask them if you don't already have your state's public affairs specialists. So the public affairs specialists are generally, I'll say, at a state level. Sometimes they're at an area level, which covers a number of states or parts of states. It really depends. It's varied. But they're at kind of the next level down. They're closer to the field office level.
All right. So those are all the questions that we have. I do just want to say that we have seen all of the amazing and gracious comments that you have been putting in the Q&A, and we've actually been passing them along in our Teams chat so that everyone can see them. We really do truly appreciate your words, especially the shout outs for specific members of the TA Center. So I think we'll probably move towards wrapping up. And I know that Kristen was going to kind of lead this section and give some final words from the staff at the TA Center.
Yeah, thank you, Abby. Thank you all for your excellent questions and your dedication to continuing this work. It means so much to us to see this work live on. Our team loves this program and we love this work and you all. And so I'm going to invite the incredible members of the SOAR TA Center team, those who want to share some kind of final words from the team. Whoever wants to go first.
I guess I can kick it off. These past couple weeks and months have been really hard, but what has made it amazing is the thought and preparation that all of you guys have been going through to make sure that this work continues. At the end of the day, the most important thing to us is that this work continues and that SOAR assisted applications are continuing to be done in your communities. It will not be easy, but we know you can do it. We will miss you. We will miss talking with you every day. We will miss training you. We will miss working with you. We will miss working with each other at the SOAR TA Center. But I think the best thing that you can do is to keep soaring in our absence. So I know that this will continue and I look forward. I know our paths will cross again in so many ways down the road. So we're looking forward to seeing the great things that you guys are going to do.
Yeah, I would just say I definitely 100% agree with Abby and just piggybacking off those words. There's the quote of, not to be dramatic, right? But there's the quote of, ideas don't die, people do, right? And so in that kind of vein, right, SOAR is something that will always live on, right? As long as you all keep it alive. And so I just encourage you, take the tools, the knowledge, the resources, everything that you've been given, everything you've been taught, everything you've been working on over the past couple of years, and just continue to soar, continue to let the SOAR model live, and continue to go out there and save lives, because that's what y'all have been doing all these years. When you're doing a SOAR application, it's so easy to look at numbers and be like, an approval numbers and this number of applications, but behind those numbers are real people. Those are real people's lives that you all have saved. And so I just encourage you to always remember that and keep soaring.
I'll go next. So it is our last webinar at the TA Center. It's also my last day at the TA Center. So this is just a really emotional afternoon for me. I began SOAR fresh out of college in 2010, and I have seen so many lives transformed through the work of SOAR. And it's not just about income, it's about giving people hope again, and the basic necessities that they need, connecting them with the resources to get there so that they can seek recovery. I thank everyone for your continued work to make sure that this doesn't end when the TA Center is closed. We still believe in the message of SOAR. I still believe in the message of SOAR, and you can continue to do great work and change lives. We are changing tens of thousands of lives through SOAR, and now it is on you to make sure that we can keep doing that as a providers.
This is Pam. I guess I'll go next. I just wanted to say it's been a pleasure the last 13 years working with many of you. I've been emailing several folks right now. So anyway, just you gave me hope maybe to get back to my roots, providing application assistance, because I know you're gonna keep soaring, and I look forward to reconnecting with some of you, and just thanks again for everything that you've taught me, and stay soaring, America.
Yeah.
I'll
In
go
addition,
next.
oh,
Oh,
good. Go, Dan. I'm glad you're
good.
talking. Go ahead.
Thanks, Daz. I I just wanted to express my gratitude to the SOAR community. I had a procedure yesterday, and I'm supposed to be resting my voice, quote unquote, but I had to say at least a few words. So I just want to say thank you to everyone that has done this work and will continue to do this work. I've been involved with SOAR in some capacity since 2012, and providing assistance to people applying for SSI and SSDI is kind of all I know from a professional perspective at this point. So it's what I plan on continue doing after the SOAR TA Center closes, and I hope you all do too. And it's been such a pleasure working with you all. So I wish you all the best in the future.
I think that and reflecting on all that has transpired over the last few weeks and months, I think that I offer you a tremendous amount of gratitude for the work that you do, and the lessons that I've learned through this work, not only professionally, but personally. I've been able to gain some really great friendships through the work that I've done with the TA Center over the last 14 and a half years. I've been able to develop really great personal and professional relationships with one goal in mind, which was always to address the needs of the people that we serve. I believe that if you keep that at the forefront of what you do, there's no way that SOAR can disappear. There's no way that SOAR would be able to be placed on a shelf as if it was something that you learned in passing. SOAR is a tool that we encourage you to continue to use to address the needs of the people that we serve. We've always, as a team, thought about the people that are served before we did any design of any tool or resource, we've always put them at the forefront. And there's so many people on this call that do the exact same thing. So it's not just my hope that SOAR continues, it's my expectation that SOAR continues because of the people that are on this call. And I just extend my gratitude, my gratefulness, my appreciation for all the work that each and every one of you do. Thank you so much for allowing us as a team and me as your liaison to be able to help provide the guidance for you to move SOAR forward. Thank you so much.
Thanks, everyone. I know Susie left a message in the chat. We have Alicia behind the scenes too. I don't think that this team could have said it any better. And I think my hope for you in the SOAR community is that one day you get to work with a team who is as talented and passionate and dedicated as this TA Center team has been. It has been one of the joys of my life to get to work with this group of people and to work for you all in the SOAR community. Immense gratitude to my team and the execution of this final webinar. Gratitude to our ASL interpreters, Kip and Dave, to our live captioner, Rhonda, to our Spanish interpreters, Enrique and Suzanne. Thank you for bearing with us as we cover complicated and probably too fast talking as we go through all of the stuff we go through. We have spent a lot of time with you all as well, and we appreciate the service you provide to the community and making sure that this information is accessible to all. All right, you guys have us for a couple more weeks. We will work our hardest to keep supporting you through that time, and let us know if anything else comes up. If you have more questions, we'll answer them for you. Thank you, everyone.